Hello and welcome. Today we're going to tackle a really important topic for women's health here in India, and that's endometrial cancer. It's a growing concern, so our goal today is pretty simple. We want to give you clear, direct information so you can understand the signs and, most importantly, know how to take action. So let's dive right in. So right now in India, there's a health issue that's affecting more and more women, but honestly, it often goes undiscussed. We're talking about endometrial cancer. But here's the thing, and this is the most important part. Knowing what to look for, knowing the signs, and acting on them early, well, that can make all the difference in the world. All right, so first things first, let's get on the same page. What exactly is this condition, and why is it becoming such a big concern right now, especially here in India? Okay, so it all begins inside the uterus. If you think about the uterus, it has this inner lining, right? That lining is called the endometrium. And that's exactly where this type of cancer gets its start. So to put it really simply, endometrial cancer is what happens when the cells in that lining, the endometrium, just start to grow out of control. And get this, it's actually the most common cancer of the female reproductive organs. And just to give you a little perspective on how significant this is, take a look at this number. When we talk about cancer of the uterus, a whopping 95% of those cases are endometrial cancer. That's why focusing on this is just so critical. Okay, this brings us to what I think is the most important part of this whole conversation, recognizing the warning signs. You see, your body often sends out signals, and really learning to listen to them, that can change everything. So I want you to just take a second and ask yourself, what is your body telling you? Have you noticed any changes? Just being mindful. Being aware, that's the absolute first step to taking control of your own health. All right, let's zero in on the single most important sign. Seriously, if you take away only one thing from our chat today, let it be this: unusual vaginal bleeding. That is the #1 symptom. And what does that mean? It means any bleeding after menopause, or even just spotting between your periods. That's never normal, and it is always a reason to go see your doctor. But, bleeding isn't the only signal. Your body might be sending you other messages that something's not quite right. Things like pain in your pelvis, some unusual discharge, or even just changes in your period, these are also really important things to watch for. Okay, let's break those down a little bit. So be on the lookout for pelvic pain or cramping that just won't go away. Also, pay close attention to any discharge that seems abnormal or watery. And hey, if you're over 40, you'll want to take note of unusually heavy or long periods. And lastly, any weight loss that you just can't explain, that's a red flag that you should definitely get checked out. All right, so we've covered the what, but now let's talk about the why. Understanding the risks and the root causes, well, that helps us figure out who might be more vulnerable and what's actually contributing to this cancer developing in the first place. Yeah, this image right here gives us a really clear picture of the problem. On one side, you see that nice, healthy uterine lining, and on the other, you can see that abnormal cell growth. So the big question is, what's causing that change? A lot of the time, the answer comes down to a hormonal imbalance. You can almost think of it like a scale. When one hormone, estrogen, gets too high, and there isn't enough of another hormone, progesterone, to balance it out, that imbalance can trigger that abnormal growth in the lining. So who's most at risk here? Well, the data points to a few key groups. It's definitely more common in women over 50, particularly after menopause. Obesity is a really big factor, and that's because fat tissue actually produces its own estrogen. Then you have conditions like PCOS or even a family history of cancer. Those also increase the risk. Pretty much anything that leads to your body having higher estrogen levels for a long time is something to be aware of. Now, if you do have symptoms, it's completely natural to feel a little anxious. So let's try to demystify what happens next. Knowing how this is diagnosed and treated can make it feel much more like a clear, manageable plan forward. The whole diagnostic process is actually very methodical, very step-by-step. It'll usually start with a pelvic exam, then maybe a transvaginal ultrasound, which gives doctors a really clear picture of the uterus. The most definitive step, though, is usually a biopsy. That's where a doctor takes just a tiny little sample of the lining to get it checked out. And after that, scans like a CT or an MRI might be used to see if anything is spread. And once a diagnosis is confirmed, a treatment plan is put together, and it's all based on the cancer stage. The most common approach is surgery, usually a hysterectomy. Sometimes that's followed by radiation therapy to take care of any leftover cells. And for more advanced cases, things like hormone therapy or chemotherapy might come into play. And that brings us to our final And honestly, our most hopeful section. Why does all of this matter so much? It's simple. Because when it comes to endometrial cancer, taking action early, that is truly the key to saving lives. I know, it's a phrase we hear all the time. Early detection saves lives. But for this specific cancer, it could not be more true. Recognizing those lines we talked about and just getting to a doctor right away, that is the single most powerful thing you can do for your health. And this number, this is exactly why it matters so much. This is the statistic that should give everyone so much hope. When endometrial cancer is caught at its earliest stage, we're talking stage 1, the 5-year survival rate is over 90%. That's incredible. And that is why we absolutely cannot afford to wait. So, the takeaway here is really simple. Your health is in your hands. You can take action starting today with 3 key steps. Number 1, know your body and know these symptoms. Number 2, commit to getting your regular checkups. And number 3, and this one is huge, spread this awareness. Share what you've learned today with the women in your life, your mom, your sisters, your friends. Because this information, it really could save a life. Thanks so much for joining us.